name is Amber Thomas. I'm the physician assistant with orthopedics here at Fulton Orthopedics, and wanted to share a little bit of information with you about the importance of prehab before a knee replacement surgery. A lot of times people, especially when they've been suffering with knee pain for a long period of time, might not have the mobility that they once had or the strength and stamina, and so when they would go to have their knee replaced, they have to do a lot of therapy afterward, and if they aren't as strong as possible going into the surgery, rehab can be much tougher afterward. Rehab after a knee replacement can be tough to begin with, and so the stronger you are going into surgery, the more flexibility you have and the more stamina you have and the stronger your muscles are, the better you will rehab afterward, and potentially faster you'll rehab afterward. And it can help with pain afterward as well, because if our muscles are conditioned a lot better, then that can really help with rehab and recovery. So we definitely encourage prehab before our surgeries. Even a couple of weeks of it can be immensely helpful for recovery afterward, and it definitely has been very helpful for people that have gone through it and are able to do that.
I'm Mindy Brown. I'm a physical therapist assistant at the Fulton County Medical Center Rehab Department. I'm here to promote the benefits of rehabilitation prior to a total knee replacement. So why is prehab so important to advanced surgery? This is to optimize your strength, your movement, as well as your fitness. Exercises for strengthening the legs, getting flexibility, and maximizing muscle length of the quads and hamstrings, as well as building your cardiovascular fitness and activity tolerance. Most programs offer a health optimizing program, whether it is losing weight, stopping smoking, anything else that will actually help you beyond your surgery. So as far as prehab, it's a program of exercises you can do prior to total knee replacement surgery to help you recover more quickly. This usually starts 6 to 8 weeks prior to your surgery. Exercises should focus on quadricep, hamstrings, and gluteal strength. We also want to focus on knee range of motion. If at any time you start having sharp, shooting, stabbing pains, then you should stop these exercises. The exercises will also be done post-surgery. The exercise bike is very beneficial for the endurance. Now I'd like to introduce Judy Eisman and for her to give her testimonial on prehab, and then I'm going to have her demonstrate some of these exercises.
Hi, I'm Judy Eisman, and when I decided that I needed to go see Dr. Epsenshade for my knee, it was to a point where I could barely walk. I had had a brain tumor and had surgery on that, and had it removed, and it left my left leg numb and did not have good walking or range of motion. So by the time I got to see Dr. Epsenshade, it was bone on bone. And he recommended prior to my surgery that I have prehab. And I really didn't understand what that was, but after going through it, I was so glad I had done that before my surgery. The PT afterwards was hard, it was difficult, but because I'd had the pre-rehab, my legs were already strengthened and my muscles were flexible. So I am an advocate of having the pre-rehab PT. And when I had my second knee done, we did the same thing, and I had excellent results.
So here is Judy Eisman. She is going to be demonstrating some of these exercises, and also these exercises you will be doing post-surgery. So the first one is ankle pumps. So basically you want to do ankle pumps in order to prevent blood clots. So basically it's just moving your foot up and down just to get that calf working and just basically to increase that blood flow. And next we're going to do, they're called quad sets. Basically, this is for your quadricep, which is the four muscles in the front of your thigh. We want to work on strengthening those. So go ahead and swing around. So basically what her focus is she's going to be basically you basically pull your toes back towards your nose and tighten up the quad muscles, which we're tightening these muscles here. And usually we do a hold with those in order to make that muscle tight and then relax. So normally what we'll do is we'll do a hold with that and we'll do up to 10 reps in order to make that quad start to work, because it's what we call an isometric movement. So through isometrics, to begin, we start strengthening those muscles. Glute sets we have, which is a very hard exercise to demonstrate, but basically we're working on the gluteal strengthening because your glutes are your largest muscle in your body. So we just work on strengthening that in order to make your transfers out of the chairs, just movement, much easier. Hill slides is another one in order to increase your knee range of motion. So you can do them laying down in supine position, or you can do them seated. So I'm going to do them laying down. Okay, so basically she's going to be bending her knee and just sliding her foot back and forth to her buttock. So this helps to increase the knee range of motion in order to help to improve the gait. This can be painful, especially if it's bone on bone, but it's basically taken the exercise to tolerance. Another one we have, it's called straight leg raises. This is also for quad strengthening. This is performed by straightening your leg, basically lifting your toe. Okay, good there. So you want to work on tightening those muscles like we did with the quad sets, and then raising your foot towards the ceiling. This can be very difficult if those muscles are weak and you may not be able to lift it up as high as what she is, but it's to work on strengthening those muscles for muscle recovery. Now we're going to do what's called long arc quads. It's another one for quad strengthening. Quad strengthening is very important with total knee replacement because those muscles become very, very weak, and if they are not strong enough, you have difficulty with ambulation, you have difficulty with transfers. So we focus a lot on quad strengthening. So to do that, basically kicking the foot straight out, contracting the quad muscles. So we're basically contracting these muscles here and then back down. And this could be another painful movement because when it's bone on bone, basically that's the movement that's happening here, is a shearing force that is bone on bone in the knee. So these are just repetitive movements without a hold. Another one here we have, it's a seated hamstring stretch. It's to decrease the tightness in the hamstrings because the hamstrings are behind your thigh, and those muscles get very, very tight with movement, with anything that you're doing. So what we focus on is decreasing the tightness there, so your mobility is much better. So scoot out to the edge of the, yep. So you want to straighten your leg and pull your toe up toward your nose, and then sit up tall and shift down. So during that shift is whenever the stretch, you're going to get a stretch in the back of the hamstring there. Normally what we do is a hold for this exercise in order to help to lengthen those muscles and to make them more mobile. And relax. And normally we do about 3 reps of that in order just to get the tightness to relieve. These exercises, we usually have them done at least 3 times a week, but try to do them 5 times a week in order to improve the mobility. And normally a lot of them we would have you do 20 to 30 reps of each. Pre-operative exercise showed better post-operative function, quadricep strength, and shorter length of stay in the hospital. while not significantly less pain. There is pain after total knee replacement. We understand that, but it is going to get better, and it should not last much past 5 to 6 weeks. Greater preoperative range of motion helps to maximize flexion after total knee replacement. Flexion is basically bending your knee, being able to increase your mobility, going up and down stairs, in and out of a vehicle, just sitting in a chair. Statistics have shown that prehabilitation intervention had a favorable impact on improving functional ability up to 30%, increasing knee strength by 50%, and decreasing pain prior to a total knee replacement.